Okay, Kelly, would you please give me, I don't care about if anybody else wants to pay attention or not, but me, the difference between quarantine and isolation. I know there's a lot of people that interchange these and they are actually two different things and two different reasons of why we do them. But could you reiterate that or redo that for me so I am straight on it, please? Thank you.
Sure. Quarantine is what we do when an individual has been exposed to a positive case, but they are not showing symptoms. So we will quarantine an individual who has come into contact with somebody who has a positive case for 14 days. Over that 14-day period, we will check to see if they develop symptoms. If they develop symptoms, then they will be tested, and if positive, we'll then move into an isolation. Isolation is what we do for positive individuals. If somebody tests positive on a COVID test, regardless of whether they're showing symptoms or not, they are to isolate for at a minimum 10 days, wait for their 24 hours fever-free without the use of aspirin or other fever reducers, and improvement of symptoms. So there's a big difference between those two.
So when people are supposed to be isolating, specifically those who have tested positive and are sick, supposed to be isolating and they're not, they're actually spreading this disease throughout the community. Correct?
Yes, correct.
And quarantine has the potential if they would get sick. So they really need to avoid people as much as they can too.
Correct.
Okay.
Because real quick, the reason being for that is a little explanation is that people can be contagious up to 2 days prior to showing symptoms. And so, or 2 days prior to a positive test. So they may not even realize that they're passing it on in quarantine.
All right. Thank you.
Okay, let's move on to new business. First item is approval of the Health Department's 2021 holiday schedule. Do you have it in the packet? Is there any change?
That's what I was just asking.
Is there any change from this year to next year, Kelly?
No, because we've had the Christmas is going over the weekend.
I make a motion that we approve the presented 2021 holiday schedule.
Second.
We have a motion and a second to approve the holiday schedule. Any discussion on that? Okay, hearing none, all in favor, please say aye.
Aye.
Anyone opposed? Okay, the holiday schedule is passed. And next item is a preliminary budget for next calendar year. It has to be approved by the December, well, before the end of the year. So the plan will be to approve it next board meeting. Is that correct?
Yes, this is a draft for your review. If there are no questions, then this will be the draft or the budget that will be presented for final approval.
So it should not have been underlined because we're not voting on it this time.
If this is a draft, if there are no changes, I'll ask Christy. But it's.
Underlying doesn't necessarily mean that it has to be voted on. It's just a first reading of it.
Okay, and just in case if needed, our comptroller is on her way if there were any questions. Otherwise, we'll divert her and tell her not to come down.
Sorry, say that again, please.
I was just letting you know that Kristen was on her way in case you guys had questions. If not, then she will.
I will supposedly have a little more detail on the next one.
So, Chris,
Well, I'm not looking, I mean, if we can get detailed budget, right? For the next proposed one, just a little more detail of kind of where, just a little deeper in what we have here just for the next meeting. If you can have it to us before that, that'd be great if you don't mind.
Sure. Are
Thank
you
you.
just looking for the line items
Yeah,
underneath
kind of a
this,
line
or-
item of where we're putting this money, just kind of, we get a little deeper dive into it.
Okay.
Thank you.
Can you show this year's and alongside next year's, please, too? So we'll move on with that and plan to vote
That was
next
easy.
month. And just so everyone's aware, there has been an audit completed, and that'll be presented next month.
We don't have the bound copies yet
Okay.
from the auditor.
Next item is to assign a custodian. Yes, I didn't realize my mic wasn't on. The next item is to assign a custodian of record. So it is my understanding each year that we are to to vote on a custodian of records. That individual will be placed on our website as an individual to contact for the community in case they are to do any kinds of records requests. Christy, is there anything you want to add to?
Yeah, based on Ken Lodge, we need to appoint that, needs to be on the website, and I can put up at the front of the building as well.
Okay. In the past, up to this point in time, I've been serving in that capacity, but I don't need to. I'm wondering, would it be something where Jennifer Pinkley might be, her eyeballs just got really big.
Typically, it is the person who keeps charge of making the minutes and the agendas and prepares them. So that's gonna continue to do that. Doesn't have to be a supervisory type of position.
Okay. Do you have a preference as to who is custodian of records, or?
Are you recommending? Are you making a recommendation for Jennifer? I make the motion for Jennifer Pinkley to be the direct custodian of records.
I'll second that.
Okay, so we have a motion and a second. Any discussion? One comment I would make is we should probably use Jetty's title or in addition to her name, just in case.
Is
So-
that something where we could do, is it the name of the person, or should we say custodian of records, care of Jennifer Pinkley, or is it?
It would be just simply from a custodian of records.
Okay. And that way, if it changes, it would get to go to custodian of records. We're not changing it,
Right,
right?
you would just name a new person.
So we're not doing it by position. At this point, we're doing it by person, correct? Okay, that's fine.
How do we formalize that?
We need to vote.
Yeah, we have a motion second. Any other discussion? Okay, all in favor?
Aye.
Any opposed? Okay, that passes. That's effective immediately? Okay.
The next item on the business is discussion of COVID-19 benchmarking for determination of zone placement and potential adoption of benchmarking institutions. 10 minutes was allocated to Ms. Davis to advocate for change in our current practices, and there was reasonable time thereafter for the board to discuss options. What I would ask is, would you like to, we can present this in one of two ways. I can. All of that was not on the microphone. Okay. The next part of discussion, I'll make it short and sweet, is about the COVID benchmarking and determining a zone placement and how we're going to track our COVID measures. I will leave it at the discretion of the board. Would you like to have Ms. Davis's presentation first, or would you like to have the presentation of our current practices first?
Current practices, please.
Okay. So we'll pull up a quick PowerPoint. I promise this will not be nearly as long as the last one.
I've been told there's no audio.
Shall we do a, can you hear me now kind of thing?
There was no audio for Kelly. I did get that, right?
That might have been what it was. Sorry. Okay, to give you an idea, we have been operating with the these COVID guidance indicators for the past several of months. We are utilizing two forms to basically be able to look at our guidelines. One of them is the Harvard Global Health Institute, which looks at the spread of COVID within a community based upon in line with CDC levels of community spread. The other is the White House Pandemic Task Force, which is looking at all of the indicators that you see on our color charts each week. If you go to the next one. One thing I do want to point out is when we originally started, the White House Pandemic Task Force metrics only included 3 levels. They upgraded that just a couple of weeks ago to include 5 levels. And so just to let you guys know, that is why there was an extension that included a light green and an orange into those schedules. To let you know, the state of Missouri is also using the White House pandemic thresholds for their guidance on the state of Missouri website. So when you're looking at their levels of positivity and their color markings on their site, their markings fall in line with the guidelines from the White House Pandemic Task Force as well. Again, just letting you know that the methods for choosing the indicators, so there's different metrics which are going down the left-hand side, everything from new cases per 100,000 a week to COVID deaths per 100,000 per week. And then depending on how many there are there, what our local numbers are, then that makes the decision as to whether or not that indicator is red, yellow, green, blue, sorry, orange. The one thing to note is on the White House Pandemic Task Force, the counties are coded, but they're not coded by if everything is red or everything is orange. They're indicators which they have to be able to show why it's red. So for a county to be red underneath the White House Pandemic Task Force, they have to have reported new cases at or above 101 per 100,000 population and a test positivity result at or above 10.1%. So we've been consistently in that. The orange zone counties have to have during their last week between 51 and 100 per 100,000 and 8 to 10% positivity. And then again, it's lower, 10 to 50 per 100,000 for yellow and a 5 to 7% positivity rate. Next. We can go on to the next one we talked. So again, just showing this slide. If you look at our indicators, they have been spot on as far as the level of transmission in the community and the number of cases that we're seeing. We've been able to identify areas of trending upward growth and reductions in cases just by simply monitoring the color designations as we've been doing them. Next. And again, just as you saw on that last chart, the one thing, oops, can you go back for just one sec? As you can tell, yellow, green, good, orange, red, bad. So as you can see on the bottom, I'm going to point this out a couple times. Left side of the chart is yellow, green. You look down, we're very low in cases. Right side of the chart is orange, red. Right side of the line chart is escalating cases. Next. Same thing in our other charts. So as you're seeing our PCR test, our lab positivity tests, our weekly case counts, and our 7-day rolling averages, they all follow that same pattern with their charts. So the guidelines that we are utilizing at this point in time have been accepted at both the state and federal levels and have been extremely accurate in terms of the types of community spread and case management that we're seeing in the community. And so it would be my recommendation that we continue to utilize those 2 measures as our official measures of the health department.
Davis, do you have anything to say?
So first of all, I want to thank you guys. for hearing, listening to me tonight, because, you know, I'm not going to always agree with what Kelly is saying over there, but I do have some things to back it up when I don't agree with Kelly. So, as long as we continue to do with what we're doing, our positive numbers are going to exponentially increase due to mainly the PCR testing and the flaws that we have with that program. Now, even Fauci himself has told us that if a positive case is magnified a couple of times on up to 30 times, and they're still not finding any positivity, then they go over 30 times. It's getting to be so minuscule, and that's his word, that you can't even find hardly a fragment. And at that point, it could be literally something that you were sick from with a cold, okay? The positive PCR tests were never designed to, and they've never been standardized. So there's no one that is literally saying, you have to stop at 30, don't magnify this culture any further than that. There's no standard to that. So yes, we do have lots of positive cases right now. So anyway, I'm going to go on. If we make a change to our approach, then we can alleviate the pressure on our community. I'm sorry, this is sucking into my mouth. I can't do this. And be sustainable over a long term for our businesses and life. We need
Ms.
to make
Davis,
a
I don't
change.
mean
We
to
need to
interrupt.
make
She needs to put,
a difference in our approach. And we need to, it will definitely alleviate the pressure on our community, our health department. It'll be sustainable over a long term for our businesses and in life in general. As a board, we have to go with what makes sense, guys. We need to not go by what the news is saying, necessarily what Kelly Vollmer is saying, but we need to research for ourselves and look into things. We need to focus on getting back to life and promoting peace and healing in this process. COVID is moving along and not overwhelming Jeffco in our region's hospitals in
That's a lie.
spite of what you are hearing. Okay, if you look at the chart that I gave you there, Mr. Pig, you'll find out that in this particular picture, I'll show you that in April, there was a spike and there was up to 205 people in ICU. Now we have more like 139 in ICU. And so we are looking at a reduction, not an increase, okay? Yes, it's been teeter-tottering around for the last month or so, but there is good news. We are about half of what we were in the ICU and half of the vented patients, and that is a fact. I do have the things to back it up. You can shake your head, but y'all have not done your homework or you wouldn't be shaking your head. So I'm not talking to Kelly, I'm talking to my board. And
Well,
so
you are
I'm
wrong.
saying, okay. So in effect, there were 10 to 16 day hospital stays at the beginning of this. And now our own Sarah, the I can't even say that word, epidemiologist here at the health department says, in her words, and I quote, that the average COVID hospital stay is now 2 days.
when
Used
was
to be
that
10,
report, Ms. Davis?
used
I'm
to be
sorry,
10
but
to
I really
16
feel like
days.
some data should
And
at
so
least, we
now
should
it
have
is
the
2 days.
sources
I'm
as they're
sorry, I have
being
the
read.
floor, Kelly. You had your
I
chance
understand that,
to
Ms.
talk.
Davis, but we need the
So
sources.
before,
Thank you.
again, we are doing good. So we're going to look for some positives here. We're going to move on. The color metrics, okay? The color metrics is given to us from the White House. It's also given to us from the CDC. And Kelly has gone and she's picked one from Harvard. And in that particular color metrics, it's telling her that she can turn our county red as long as there's at least 25 positive cases. Well, that's absurd, okay? So the White House has given us a standard.
Excuse me, you need to clarify that because I believe it's wrong, but try it again, please. On the 25 cases.
So her metrics that she's using from Harvard,
It's Harvard's metrics.
Yeah, yeah, it's Harvard's
that-
metrics
The one with the White House.
says that at 25 cases, you can call it red.
Is that true?
And White House task force says it has to be 100 cases.
It's 25 per 100,000.
Yes. So I'm going to explain that, Kelly. It's my chance on the floor. Please don't take
appreciate
my
your chance on
time.
the floor, but can you please get
Please
the
don't take
information
my
correct
time.
so that you don't
Let
spur
me
the rest of
finish.
the
I will
county up with
explain to
misinformation.
Tim. So if we have 200 cases today, Tim, 100 cases tomorrow, 50 cases the next day,
I'm gonna tell you this,
75
you don't need to
the
explain
next
it to me
day.
because I get it and I got it. You're the one that's
Then-
confusing all the information.
let me just share,
You're
because it's my
confusing it.
sharing
You're
time.
You're confusing it, you're conflating
In a
it.
7-day
pieces here and put it over
period
there.
of time,
It's crazy.
in a 7-day period of time, those 7 days get averaged together. They get divided by 7. Now we have 200,000 population in Jefferson County. It also gets divided by 2. Actually, it should be divided by 2.4 because we got 240,000. Right, so 2.4 it should be divided by. But anyway, so it gets divided by 7. So if maybe we have 1,000 cases all week long, it gets divided by 7 for the 7-day average, and then it gets divided by 2.4. That number has never been more than, it started out a couple months ago, like about 26. We got thrown into the red. We should never have, because the White House says that not till we're 100 cases are we in the red. Okay. So the Harvard study says that you can be in the red at 25. So that's why I'm saying, okay. So then it went up to like in the 30s, 40s, and it went up to 60. Last time I looked, it's like at 90 something right now. Now we're approaching the red according to the White House task force and the CDC. That is the standard that we must go by, not by Harvard and not by anything else. So that's what I'm saying there. Okay, so I'm going to go on. As long as you guys understand how. I know that if you have 7 days full of kids. Okay, so Kelly, honestly, how many cases do we have this week? Yeah, altogether over past 7 days. How many cases total? Okay, so 1,400 cases put into my calculator and divided by 7 because it's a 7-day rolling average. It's a daily rate. 1,400 cases for this day. No, I'm right on this. 1400. So you're saying 1,400 cases for the week divided by the 7-day rolling average is 200. Divide that by 2, which is our 100,000 population. We have 20,000. Okay, so you take, so obviously you guys don't understand how this is figured, or you wouldn't be saying that to me, because the White House task force says that we should be using their metric, their standard. And then after 100 cases on a 7-day rolling average and take into account 100,000 population, you divide it again by 2, then that number, which has never gone over 100 yet, it's at 96 this week. It was before that like 25, 30, 40, 60. Okay. Never been in the red. That's my whole thing here, is that we need to use the standard that the government gives us, not something from Harvard. So let me go on. I've made my point on that. I have 10 minutes, so no. And so the next thing is here's the solution to this whole thing. Okay. I want to say one more thing real quick, is that we are not at capacity. According to the slide from the gentleman that was speaking tonight in the St. Louis Pandemic Task Force, it says that we have 13% of the beds are occupied in ICU right now. And we have we have a lot more that we can put people into, and
85%
we're
of
doing
beds.
just fine. So that's what I wanted to say there. I think we need a lot more positivity. Here's the actions I think we need. We need to move to use the White House Task Force and the CDC benchmark metric instead of Harvard. I think we need to stop the PCR testing at some point. I think we should consider seriously bringing in the point of contact type tracing, which test, which is you get your immediate results within 15 minutes. And that way somebody can tell if they're positive. The schools could have them. The doctor's office already has them. Different places like long-term skilled cares could have them. And they could, people
Mr.
can
Chair, I
know
make
the
a
result
motion that we
right then
close
and
this
there
discussion
instead
at
of
this
waiting a
point in
few
time, please.
days, going into quarantine and isolation needlessly. They
Make a
can find
motion
out
that
yes
we
or no, they are
close this
positive or not.
discussion at this time, please.
And so my time is not up. Okay, so the point, I wanted to ask Kelly a question. Have we
I
got
have asked for
any,
closure on this discussion, please.
You have one more.
There's a first and a second on the floor, Mr. Chair. We need to vote on that.
vote on what?
A motion to close
All right.
discussion that I made. It was seconded by Ms. Amber. And we
Why
should
would
need
we
to have a
close
vote.
discussion that we're not done discussing?
You know, Ms. Davis,
I have a question
we
for
need
Kelly.
to sit down and talk about this. Your methodology is incorrect. And because it
My
is,
methodology
you're,
is not actually clear.
well, yes, it is. If you say
We need to use the White House metrics, not
we are,
Harvard metrics.
we are using those.
She's using the metric that says you can turn us red at 25 cases.
Okay.
All right, we cannot turn red until 100 cases. I'm sorry.
All right.
We've
So
not
we
turned
have,
red all this time.
you're absolutely wrong.
That
Uh,
we've not been in the red this whole
okay, so
time.
You're
we have-
wrong. You are absolutely
We're
incorrect.
approaching it now. We're at
You're
96
incorrect.
cases.
You're
We have-
incorrect. That's all there is to it.
I'm not incorrect.
So we
You
have a
can-
motion
we have-
and
It's not.
a second.
You're
to-
incorrect.
It's
to
not.
move on.
Can I vote
We're
aye
at
for this? to
96
move on?
cases. Look at the
Who
health
votes-
department
who votes to
website
move
right
on?
now. It says
Move on.
96 cases
Okay.
today.
All right, we're going to move on here to closed session.
Do we, number 5 is,
Oh, I'm sorry.
sorry. Okay. Number 5 is the adoption of benchmarking institutions for COVID-19 tracking. Again, as was presented momentarily ago, we utilized the White House Pandemic Task Force measures. The measures that are utilized by the Harvard Global Health Institute, which fall into line with the CDC measures.
Which says that
Miss Davis, I have the floor. We have utilized the White House Pandemic Task Force measures that are in line with both the state and the federal government in terms of how they color code, as well as those are reinforced by the Harvard Global Health Institute indicators. They run exactly the same as far as their color coding. I ask the board to reaffirm that the board's chosen method for determining the color status within Jefferson County continue to be the White House Pandemic Task Force measures and the
of
Harvard Global
100
Health
cases before it's
Institute
red, yes.
measures that we have been utilizing for this past several months.
So do we have a motion?
I make the motion that we continue to use as we have been using.
Second.
Okay, I think we've had lots of discussion, so all in favor of continuing with current benchmarks, please say aye.
Aye.
Aye. Anyone opposed?
I'm in opposition, clearly, and it's fraudulent to make numbers so low that it puts your whole entire county into the red when they should only be in the yellow.
I make a motion, we go into closed section, reference to 610.021, sections 1, 2, and 13.
I second.
All right. Discussion. All in favor of going into closed session? Oh, we need a roll call? on that?
Yes.
Yes, okay.
Mr. Pig,
Yes.
Dr. Henry,
Yes.
Mr. Prater, Mr. Pig,
Yes, again.
I also say yes.
I'm so sorry. Mr. Deal
We pass it on.
and Miss Davis.